Doreen 𝗂𝗓𝗓 is the
Dr. Doreen is an expert in autism.
Doreen 𝗂𝗓𝗓.
Dr. 𝗂𝗓𝗓.
Dr. Doreen 𝗂𝗓𝗓.
Dr. Doreen 𝗂𝗓𝗓 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Steve has said, hello, I would like to know, when is one in the clear when it comes to regression, or is that something that's always a possibility? It's a great question.
Yeah, it is a great question, Steve, and I think the answer is no. I don't want you to think that regression is always going to happen. Regression will happen to some extent when if your child is really young in acquisition, so they're in a program, they're learning fast, and then suddenly there's like 3 months of no therapy. So that used to happen a lot. We would fight it because schools used to be our only source of funding, and then when school was out, the child would regress. But if you want to, but that's, even when the child loses some skills, remember those skills tend to come back fast when you go back into therapy. So it's not like they're lost forever. The other thing is, obviously, if your child is on a diet of some sort and you take the child off that diet, there could be some regression in the sense that they're not able to perform, as we were just talking about it, and they're a little bit spaced out or out of it. Issues like yeast can cause some regression in overt behavior. So there's those things, but no, the older you get, the less there is of that. It's a little bit more volatile when you're younger, and I think it's because you're so actively learning and things affect you a lot faster. So when you're past, let's say, age 10 or so, those periods of regression tend to be a lot less. And always remember, when we talk about regression, it's not like you've lost and you're starting from scratch. They've just been temporarily put out of use, and you can get them back faster, those skills.
Yeah, as long as you're paying attention.
Yes, yes.
For sure. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.